Welcome to the SAO training on OPEB for GAAP governments. For this training, we will be covering the basics of OPEB reporting for GAAP governments. We will go through what an OPEB liability is, how to use the tools provided from the State Actuary's office, and the financial reporting requirements. If you would like to read more information about OPEB reporting requirements, please reference the BAR's manual by going to sao.wa.gov and clicking BAR's GAAP Manual. There are several areas for reporting and accounting of OPEB liabilities and other areas. What is OPEB? OPEB, or Other Post-Employment Benefits, refers to benefits other than pensions that are received after employment ends. This consists of post-employment healthcare benefits for medical, dental, vision, hearing, etc., whether provided through a pension plan or through a separate plan. It also includes other benefits such as death benefits, disability, and life and long-term care insurance when it is provided separately from a pension plan. An OPEB liability is projected payments that are determined by an actuary for benefit payments that are attributed to a past employee's service. To make this a little clearer, OPEB liability is an estimate of how much money someone needs to cover the future OPEB benefits promised for employees' past work. The measurement is determined through actuarial valuation. It must be done at least biannually. The liability for OPEB is as of the measurement date, or it can be rolled forward from the valuation date. If it is rolled forward from the valuation date, it must be no more than 30 months and 1 day earlier than the employer's reporting date. So, if the government's reporting date is 12/31/2024, the measurement date could be no earlier than June 30th, 2022. The good news is that your actuary should know these rules, and they are documented in the BAR's manual, so you don't have to memorize this. We also wanted to highlight the difference between the valuation, measurement, and reporting date. The valuation date is the date the actuary performs their valuation. It can be rolled forward to the measurement date. The measurement date is the date the OPEB liability, deferred inflows, and deferred outflows are measured. It's the reporting date of the plan. After the actuary completes their valuation, it still takes a lot of time and effort to measure the OPEB amounts. That's why there can be a lag between the valuation and the measurement date. Lastly, the reporting date is the employer's year end. You will not roll forward from the measurement date. That means you use the OPEB liability amount calculated by the actuary as of the measurement date, even if the measurement date is different from your fiscal year end. The most common example we see is actuaries using a measurement date of 6/30 when the government has a fiscal year end of 12/31. There are two most common OPEB benefits that are provided by local governments. The first is PEB, or the state's Public Employees Benefits Board plan. This plan provides OPEB through the plan's explicit and implicit rate subsidies for retirees. The second is LOF1, short for law enforcement officers and firefighters, which under state law, employers are obligated for lifetime medical expenses of their LOF1 retirees. Governments can also create and sponsor their own OPEB plans, but that is less common. For more information about trust and non-trust plans, please reference the BAR's GAAP manual. I mentioned explicit and implicit subsidies, so let's define those. An explicit subsidy is when the government is explicitly paying part of the retiree's premium. So the government is subsidizing the retiree's premium. The OPEB liability, then, is essentially the part of the premium that the employer will be required to pay over the life of that retiree. Many plans, though, have implicit rate subsidies, which are also called blended premium rate. Sometimes people think that if a retiree is paying 100% of their own premium, then there is no OPEB liability because the government isn't explicitly paying the retiree's premium. However, that is not true. With an implicit subsidy, their retirees and active employees are included in the same cost pool. That basically means retirees pay the same premium rates as the active employees, but retirees tend to have higher costs than active employees. For example, with healthcare OPEB, retirees typically need more healthcare and cost more money. But with the implicit subsidy, they're paying the same rate as an active employee who typically has lower healthcare costs. That means the active employees are implicitly subsidizing the retiree rates. The retirees get to pay lower premiums because they were included in the active employee cost pool. In this case, the OPEB liability is the difference between what the retirees are actually paying and the higher rate they would have to pay if they weren't grouped in with the active employees. OPEB plans are either defined contribution or defined benefit. Defined contribution plans are plans when each employee has an individual retirement account, and while the employee works for the government, you add contributions to their individual account. When they retire, the contributions in their account is all they get, so if their account runs out of money, they stop receiving benefits. The government is not obligated to provide any more money to that individual's OPEB account after they retire. If you have a defined contribution plan, you don't have a liability because as soon as the employee retires, you don't owe them anything else. You would not report any liabilities on your financial statements. However, you are required to disclose the plan in the notes to financials. The BAR's manual has more information on the required disclosures. Defined benefit plans, on the other hand, promise employees a certain level of benefits after retirement, regardless of how much they or the government contributed during employment. That means, even if there's not enough money set aside to pay the OPEB benefits, the government is required to contribute more to cover that difference. That's why you have a liability that needs to be reported. The actuarial valuation is calculating the estimated amount that those promised benefits will cost the government in the future. Both PEB and LEF that we talked about earlier are defined benefit plans with liabilities. If your government offers a different plan and you're uncertain about whether it's a defined benefit or a defined contribution, please contact the SAO Help Desk. Well, how do I get my OPEB liability? Plans with less than 100 members can use the Alternative Measurement Method, or AMM, tool. The Office of the State Actuary provides an online AMM valuation tool for the Public Employees Benefits Board, PEB, and also for LEF1 plans. Other OPEB plans do not have pre-built tools. Many actuaries can perform this calculation for you for OPEB plans that do not have a pre-built tool. Also, if you have more than 100 participants in PEB, LEF, or another OPEB plan, you must get an actuarial valuation. There are no alternative methods for plans with more than 100 participants. This slide shows the specifics for what classifies as a member. So, a single employee will be one member. If the employee has a spouse, the employee and the spouse would still be one member. If the employee had kids, it still stays one member. The membership is determined for the employer as a whole, so there is no subgrouping. Now we want to take a moment to walk you through how to find the OPEB tool. If you go to the link provided, leg.wa.gov/OSA, it will bring you to the Office of the State Actuary's homepage. Once you're on the homepage, if you scroll down to the Actuarial Services tab, you will click on that. Once it brings you to the Actuarial Reporting page, click on the OPEB tab. Then, when you scroll down, you'll see the most recent OPEB AMM tools for you to use. Again, these tools are only available for PEB and LEF1. Before jumping into the tool specifics, we wanted to give some tips for the tool. Remember to download the tool before attempting to use. It will not allow you to edit the data if you don't download it. Also, be sure to download the correct tool. Only PEB member employers can use the PEB tool, and LEF1 employers can use the LEF1 tool. You must have less than 100 total members, active and retirees, to use the tools. When gathering your data, to request OPEB retiree data, email the healthcare authority at hcadata@hca.wa.gov. The request should include a clear description of the data you are requesting to ensure you receive data in a timely manner. When you enter the data, you can modify cells, however, do not delete cells. This will cause the tool to not calculate amounts correctly. Ensure that you enter average age of employees, annual covered employee payroll amounts, and beginning OPEB liability, then click the Calculate buttons. If you do not have a beginning liability, that amount will be 0. This is an example of the OPEB AMM tool. As you can see, there will be data inputs that you are able to enter. You will put the number of active employees and retirees in the appropriate age divisions. Be sure to also update the average active and inactive age. Again, update beginning total OPEB liability if you have a beginning OPEB liability. You should also update your annual covered employee payroll amounts. The covered payroll is the payroll of all employees that are in the OPEB plan. Also, the Calculate button is a macro. That means you need to enable macros to use this tool. If you are unable to run the macro, connect with your IT department for help. We cannot help you enable macros. This slide goes more in depth on calculating the average age. You will add up the total age of all employees in the age range and then divide by the number of employees. This average age will be input into the AMM tool. Here is an example of the LEF1 AMM tool. As you can see, the active and retiree data columns are combined for this one. Don't forget to update average age, annual covered employee payroll, and beginning total OPEB liability. Once you have clicked Calculate, on the GASB Results tab, you will see the OPEB liability that was calculated. The two most important amounts are the total OPEB liability ending and the transaction subsequent to measurement date, which we'll talk about in the next slide. These amounts are what you will report on your financial statements. The rest of this information is needed for your notes to the financial statements and your required supplementary information schedules. In the Additional Disclosures tab, the tool will estimate transactions subsequent to the measurement date. This is your deferred outflows. You will multiply your projected monthly subsidy by the amount of months your fiscal year is subsequent to the measurement date. For example, if your fiscal year end is 12/31, it would be 844 times 6. If your fiscal year end is 8/31, it would be 844 times 2. Please note the projected monthly subsidy will be specifically calculated for your government, so these numbers are just an example. The Additional Disclosures also calculates your current portion of OPEB liability. We will also go over some reporting requirements for GAAP OPEB. For the notes, there are specific templates for qualifying trust or non-qualifying trust plans. These can be found in the BARS manual based on the plan that you provide. If you participate in PEB, that is a non-trusted plan, so you will use the No Qualifying Trust note. For other plans, you need to determine whether they have a qualifying trust or not. Please submit a help desk if you need help with that determination. Additionally, there are OPEB plan schedule templates available for reporting the RSI. BARS section 4.7.4 outlines all of the RSI requirements from GASB. Our BARS reporting template page has template RSI schedules that you can use. Lastly, on the financial statements, we have an example of liability amounts on the statement of net position. Be sure to split up current and non-current liabilities on the financial statements. You will also have deferred outflows of OPEB. All of these amounts are calculated from the AMM tool or your actuary. If you have any questions about your specific OPEB calculations or plans, please submit a help desk to our office. You can do that by visiting sao.wa.gov and then clicking Client Login. Once you are logged in, select Submit Help Desk Question under the Other Actions tab. There, you can fill out a help desk and one of our subject matter experts will be happy to assist you. That concludes our training over OPEB for GAAP governments. If you would like to submit a help desk, please click on the link provided in the slide or go through the steps in the previous slide. Thank you and have a great day.